Good afternoon. My name is Bianca and I'm the nurse that's going to be performing your physical assessment today. If I can have you, the patient, verify that it's okay that we go ahead and do this assessment?
Yes, it is.
Very good. And if you can tell me your name and your date of birth, please.
Jonathan Stevenson. I was born July 2nd, 1994.
Very good. And I can see that that's the correct information that you provided. Very good. I'm going to go ahead and perform hand hygiene as well as provide privacy for the patient before we continue forth with the assessment. So I'll be washing my hands and now providing for privacy with our curtain. And Jonathan, if you can tell me what year it is.
2019.
And do you know where you are right now?
Yes.
Where are you?
Sarasota Memorial.
Very good. So the patient has just verified with me that they are oriented to the time, place, year, and person. So all of those are great. That means that my patient is mentally oriented and aware of the surroundings. And if you can, we're going to go ahead and assess his cranial nerves. We have cranial nerves 1 through 12 that we're going to be assessing. We unfortunately will not be doing the olfactory, which is our first cranial nerve, which is the sense of smell, just due to that fact we know you can smell. It's all good, and I have nothing specifically for you to identify with your sense of smell. How we would go about doing that, if we would be assessing that, is I would have the patient close their eyes and smell something that they are not visually seeing, and them able to detect what it is that they are smelling, which he's done plenty of times. We're now going to go ahead and assess the optic nerve, which is assessing a person's ability to see. And we have the Snellen's test, which I have here beside me, that we're going to be using to have the patient assess their sense of sight. I'm going to be standing 10 feet away from the patient currently, and due to his glasses and need to see them because he is nearsighted, we're going to have him hold those and wear those during this assessment. If you can, please cover one of your eyes for me. And if you can please read line number 8.
DEFPOTEC.
Very good, and cover the other eye and read the same line, number 8.
DEFPOTEC.
And uncover and read number 8 again with both eyes.
DEFPOTEC.
Very good. So the patient is able to go ahead and use our Snellen's test here and appropriately answered and has 20/20 vision with the use of his glasses that he wears. We are next going to be assessing the ocular motor nerve of the cranial nerves, which is cranial nerve number 3, which I will be using my pen light to go ahead and assess the pupillar reflex. If you can, please remove your glasses for me. And I'm going to be waving the pen light over his eyes to go ahead and assess and see how his pupils react to the light. Very good. So his pupils would constrict whenever light is present, which is a normal and appropriate response. So the cranial nerve is intact. For number 3, the ocular motor. We're going to then go ahead and assess the cranial nerve number 4, which is a trochlear, by having the patient follow my finger and look up, and then looking down and looking left to right. Very good. And all of those, the patient is able to follow my finger, so that is testing the cranial nerve number 4 and 6 by his ability to go up and down, and also with the ocular motor they can go side to side. So that has been an assessment for all 3 of those nerves. We're next going to be assessing the trigeminal cranial nerve. So if the patient, if you could clamp down on your teeth for me, kind of clench your teeth. And are you feeling any pain or sensation here in the cheek area?
Tension is tight.
Okay, good. If they were to have any sort of pain or sensation, that would be positive for possible TMJ, which is that disorder where it's affecting the trigeminal nerve. However, this patient is saying that he does not feel any of that, so his trigeminal nerve is intact and has a normal finding. We next will be going on to the abducen, which was the cranial nerve 6 that we did by having the patient look down. So all 3 of those are intact. And then the facial nerve, which would be number 7, we're going to have the patient smile and look straight, have your face looking straight and look straight forward and smile. Very good. So the patient has a functioning cranial nerve due to his ability to control the facial expressions. Number 8 is the acoustic, which the patient has been demonstrating so far because he's able to follow my instructions. The cranial nerve number 9, which is the glossopharyngeal. If you, my patient, can open and say ah with your mouth. Yes, you can. Open and stick out your tongue and say ah, please, for me. Longer, like ah. Ah. Okay, very good. So the patient, when they are saying ah, the tongue is midline as well as the uvula, indicating that all of the glossopharyngeal nerves are intact. We're then going to move on to the vagus, would also be assessing that by the patient's alignment with their tongue in the uvula, which was demonstrated appropriately. The accessory nerve, which would be cranial nerve 11. If you can shrug your shoulders for me, and down, and again, good. And you can also move your head left to right. Very good. So the patient also demonstrates that they have good use of their accessory nerve, which is cranial nerve 11. Our last nerve, if you can do me the favor of sticking out your tongue and pointing it left to right. Good. That would be our cranial nerve number 12, which is the hypoglossal cranial nerve that we would be assessing there. So all of his cranial nerves are intact and functioning normally. We're now going to move forward, which we kind of already assessed his eyes and the pupillar reflex. They are reactive to light, equal about 3 millimeters in diameter when I assess them. So now we'll go forward and move on to kind of the ear portion. From what I'm looking also overall at the whole aspect of my patient, I'm not seeing any abnormalities, any lesions or masses in the head or neck area. I'm also going to be going forward to palpate after we assess the ears and the mouth. While I have my pen light, I'm going to have you open and stick out your tongue. And I'm going to be looking into your mouth, and I see that your oral mucosa are moist, clean, pink, and your teeth are intact. So that's a good normal finding that we're finding by assessing the mouth. I'm then going to go ahead with my tuning fork tool to assess the ears, first looking into the ears. Okay. And both ears are looking good, just some minor earwax, which is normal. It's good as a natural response for the ears to have a little bit there for protection. I'm now going to be using my tuning fork here to go ahead and perform the Weber's and Rhines test. The Weber's test will be performed by me taking the tuning fork and hitting it and holding it up to your forehead, and I want you to let me know if you can hear kind of the resonance within your ears when I do so. Can you feel the vibration?
Not really. Yes. Yeah.
Okay. Now we're then going to go ahead and perform the Rhines test, which is testing the kind of resonance versus bone vibrations that the patient may be feeling. So I'm going to go ahead and you still feel it ringing?
Oh, yeah.
Still feel it ringing? Very good. So the patient has demonstrated with the use of the tuning fork a positive or normal finding with the Weber and Rhines test. His ears looking and upon inspection are looking normal and within the normal findings. We're now going to go ahead and I'm going to palpate around your neck to assess these areas. Hold your head straight for me, please. Thank you.
Don't take them.
I'm going to be just palpating around the lymph nodes, and I'm going to also be assessing for the carotid, which the pulse is regular with 2+ quality at the carotid. I'll be doing the same on this side. It's important not to hold both carotids at the same time. I'm not seeing any jugular venous distension in either side. Everything is feeling good with no masses or lesions. Very good. I'm feeling no masses or lesions in the chest area. And upon inspection, my patient overall, his skin complexion is clean, dry, intact with no skin breakdown, no redness. And if I can also just see your arm for a moment. And he has a good positive skin turgor with no sense of dehydration. I'm next going to go ahead and move forward to assessing the chest. And by doing so, I'm going to take my stethoscope, and first, after I have inspected the patient, I see no masses or lesions. I'm going to then inspect or auscultate with my stethoscope. If when I touch your chest, sir, if you could please take a nice good deep breath for me, okay? Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Good. Good. And I'm also going to be listening to your heart in the mid-clavicular space. And heart sounds S1 and S2 are noted. And all of the lung sounds are clear throughout the entire bronchiovesicular sounds are also clear. I'm then going to be percussing. So if I can have, I'm going to be placing a finger and tapping. And very good. So I properly percussed. I sense no abnormalities there. I'm then going to go ahead, and if the patient can please turn to their side for me so I can assess the posterior side of you to listen to your lung sounds posteriorly, please. Very good. And so I'm going to go ahead with my stethoscope, and as we did before in the front, if you can take some deep breaths whenever my stethoscope touches you, please. Deep breath. Good. Deep breath. And again. And again. Deep breath. Deep breath. Deep breath. Deep breath. Okay. And then I'm going to go ahead and percuss. And all those percussions are found to be normal as well, and there were clear bronchiovesicular sounds posteriorly. I'm going to then go ahead and have the patient turn back forward for me, please. Thank you for turning around. And the last kind of part of one of the last parts will be also assessing the GI abdominal area. If I can also have the patient verify, have you been passing gas?
Yes.
And have you had a bowel movement today?
Yes.
And was it soft, brown, and formed?
Yes.
Very good. The patients verify that they've been having bowel movements regularly, they've been passing gas, and then I'm going to be going ahead to first inspect their abdomen area. I don't see any masses or lesions noted. I'm next going to be listening or auscultating with the use of my stethoscope. If you can remove your hands for me, please, sir. Thank you. Sorry, you a little ticklish? Okay. I apologize for the next part. So all of those his bowel sounds are normal, active in all four quadrants. So he's having good bowel sounds. I've been able to auscultate or hear them in all four of those areas. I'm next going to go ahead and palpate the abdomen to see if I can feel any masses or lesions. Now, if the patient's very ticklish, such as this patient, I will try and do my best to do the comfort of the patient.
Go for it.
Can you please remove your hands? Okay. And I'm noting no masses or lesions upon palpation. The last part will be percussing, and with the abdomen, because it is kind of a hollower cavity opposed to the lungs, I will feel a little bit more of dullness when I do percussion, and I've performed it and found normal findings with those as well. The last things we'll be assessing today will be the peripheral overall aspect of the patient's circulation, strength, and reflexes. So if I can have the patient turn their arms for me so I can assess your radial pulses bilaterally. And I'm able to palpate both of the radial pulses with 2+ quality. I'm then going to go ahead and feel your popliteal by behind your knees there, and are with 2+ quality. I'm going to next do your tibial pulses, which are back here behind the Achilles, and they're with 2+ quality. And then I will also be assessing his pedal pulses, which are equal with 2+ quality. All pulses that have been assessed bilaterally are equal with 2+ quality. And if I can also see your fingers for me. And I'm assessing capillary refill. And all of those on the upper extremities have 2+ quality. And on the lower extremities also have less than 3 seconds for all of the capillary refills, indicating that it's appropriate normal finding and a good circulation for the patient. We're next going to be assessing your strength. If you can go ahead and squeeze both of my hands as hard as you can. Very good. 5+ quality with his strength. And then if you can go ahead and lift up your legs for me. And with this one, if you can press on the gas. And then also pull up towards your nose. Very good. 5+ quality. And our falling leg, do the same on the gas and up to your nose. Very good. All reflexes or strength in his upper and lower extremities are with 5+ quality and very good, functioning normally. I'm then going lastly to be assessing the reflexes of the patient. So we'll be assessing the upper reflexes, which is the bicep and triceps. So we'll be doing those bilaterally. First, if I can have you hold out your arm as such. And when I'm going to go ahead and hit the hammer, there should be a response.
Can't see it.
Go ahead. And very good with the other arm. Good. So he has an appropriate tricep response in both arms. And then if I can have you lay out your arms here, and we'll assess the brachial. Very good. And brachial responses are also intact. I'm then going to have you set up your knees for me. As best you can. There you go. Perfect. And we'll test the planters, which should have the leg kick out in a response. Very good. And the other leg. Very good. And then we're going to also be assessing the plantar's reflex. So if you can hold out your leg for me and your foot. And I'm going to go ahead and feel along, and his foot should. Very good. Okay. And plantar reflexes are also normal and within the normal findings. All of our assessment has been completed today. I thank you for coming and participating.